Kratom. You've probably seen it in gas stations near the checkout counter with the quick energy drinks, pills, and tinctures. And you probably had no idea that this particular supplement is nicknamed Gas Station Heroin. It isn't heroin. But what is it? Kratom is a tropical tree that grows in Southeast Asia, and its leaves are used to create products that in low doses act as a stimulant like caffeine, nicotine, Adderall, cocaine, and methamphetamine, and in high doses act as a sedative like Benadryl, Valium, Ambien, and ketamine. What are the effects of Kratom? To explain more about the side effects of Kratom, here's one of our local addiction specialists, Chelsea Roth.
Kratom has known side effects, including weight loss, dry mouth, nausea and vomiting, constipation, muscle pain, liver damage, and high blood pressure. Kratom also affects the mind and the nervous system. It causes dizziness, drowsiness, hallucinations, delusions, depression, trouble breathing, confusion, tremors, and even seizures. Regular use of Kratom can lead to physical and psychological dependence. Just because this stuff is sold in gas stations doesn't make it safe. Withdrawal symptoms are actually similar to that of opiates. They include muscle aches, insomnia, irritability, and intense cravings.
Is Kratom dangerous? Here's one of our local pain doctors, James Potter, to explain.
Kratom can be an especially addictive substance. Kratom occurs naturally, but it can be broken down into other components. One of the components that it can be changed into is a medication or drug called 7-OH. 7-OH is especially addictive because it is 13 to 50 times as powerful as morphine. Other things that can happen if you're taking Kratom regularly would include liver toxicity. Medications may not be broken down appropriately by your liver. It can also lead to cardiovascular problems such as tachycardia or hypertension. It can also lead to seizures. Because Kratom is often sold as an unregulated medication, it can contain heavy metals or bacteria such as salmonella. These medications can lead to cardiovascular side effects such as tachycardia or hypertension. They can also lead to seizures and liver toxicity, which may result in liver failure. Because of these dangers, the state of Utah passed a law in March 2026 that bans synthetic Kratom, including the highly concentrated 7-OH, limiting sales to pure leaf Kratom. The law also restricts sales to specialty tobacco shops, increases the legal age to purchase to 21, and regulates the products being sold in the state. This law goes into effect May 6, 2026.
What can you do if you have been taking Kratom and can't stop?
Sublingual buprenorphine products, including Suboxone and Subutex, are being shown as very promising options for detoxification and maintenance replacement therapy for Kratom users. There are also several inpatient detoxification options available.
If you or someone you know has questions or needs help with addiction, talk to your primary care provider or make an appointment with Dr. Potter or Chelsea today. You have a whole community of health professionals who want to help you live your best life.